In the earlier video, I mentioned a few things about the traumatic reconstruction, that is reconstruction in trauma. Now I will be discussing about a few procedures in aesthetic surgery. So as I said, the basic is reconstruction from bringing the abnormal to the normal. Now from the normal to the a little above the normal, or rather supranormal. So as I mentioned, a few or many of us are born with the minor deformities, either noticeable or unnoticeable. For example, nose or ears or anything. For example, small curvature. You might have seen many people with different types of curvatures of the ear. These are correctable nowadays. If it is very minor, definitely people don't consider, or rather consider for surgery. Whereas if it is gross, then definitely it comes under correction, that is a reconstruction. So the aesthetic part. In the aesthetic part also, we can divide into three zones. What is face, body, that is chest part, and the remaining body. In the face, so many corrections can be done, starting from the hair transplantation to the nose job, that is rhinoplasty, where rhinoplasty means some people are born with the small noses. We can increase them depending on, or to the reasonable extent, or decrease them when the noses are very large, or when they are crooked. Definitely they are correctable, as in after trauma or by birth deformities. If they are crooked, definitely they can correctable. So this is rhinoplasty. Then comes a facelift. Facelift is as we keep aging, what happens is the tissues sag down and folds start appearing, and then the fat also deposits, which used to be in the upper part, then slowly migrate downwards, causing lumps in these zones. So we literally in facelifts, what we do is we take the position, that is we take it back, or we bring your shape back to your that is at least over 10 to 15 years back chronologically. So we try to make you look a little 10 to 15 years younger than what you are now. So that is the thing. So by doing what? We cut the skin in this zone, we lift the entire fascia, redistribute the fat, tighten the muscles, and finally close the skin. So like this facelift. Then comes the chest. Some people have small breasts. We increase them by augmentation rhinoplasty, by placing some implants, and nowadays the latest method is implanting your own fat. Transfer the fat from your own somewhere else where it is more, and then place it in the area where it is less. That is FAT, F-A-T, fat auto transfer. One of the latest and the best methods it is considered, especially for minor defects. For example, sunken cheeks. We correct it with the fat. Then comes the other parts. For example, liposuctions, wherein we take out the excess fat from the belly region or thighs regions, or the lifts, that is thigh lift or tummy tucks, the excess part of the tummy, that is especially after deliveries, what happens is there significant sagging of the skin. Why? When the baby is there inside, the skin tries to accommodate it by sagging. It may not contract back to the same extent as it has sagged. So after a certain time, that is 6 months to 1 year after delivery, if the skin doesn't contract, we try to take out the excess skin. Like this, we try to correct, or rather improve the appearance of various minor or rather unnoticeable deformities, especially in the form of aesthetic surgery, and then we try to make the patient look better, and indirectly we make them feel better also. Many times we try to achieve perfection. Sometimes we may not be able to achieve the perfection in the first sitting itself. Those things, minor corrections, are usually possible either in the secondary corrections. Like this, for every problem there is a solution, and we can make the patient look definitely better by plastic and cosmetic surgery.